It's hard to imagine a more spectacular location to celebrate a wedding than Stanwell Tops, an hour's drive south of Sydney. No one at this celebration could have suspected that a guest who'd flown in from America would arrive here with a wedding crasher like no other. That one person walked in with COVID-19.
I'm Sally Hawach. I'm a mum of 3 and I live in Sydney. I was at a wedding in Stanwell Tops and there was someone there from overseas who had flown in. I don't think anyone could have imagined at that particular point just the gravity of the situation.
Devastating news for the newlyweds came just days later with 39 of their guests testing positive to coronavirus.
I mean, understandable that your concern is with all of your guests and their well-being.
It's been obviously a very trying time and our main concern has just been to focus on their welfare.
When I got the phone call, we thought we were probably fine. And so then to be told that we had coronavirus, it was a lot of fear of the unknown. I was in my 3rd trimester with baby Johnny.
You know, when the news started coming in, it was just devastating and really
Heartbreaking.
My biggest fear was losing our baby, but also watching my 1-year-old Mirabelle suffer through coronavirus with really high fevers, and the pain that she went through was heartbreaking. And my husband and I also having the virus. There wasn't even certainty over what to do if I went into labour. I wasn't even able to go into a maternity suite because of the virus. Whilst I had coronavirus, I had telehealth conversations with my obstetrician because that was the only way I could have any kind of checkup was just a phone check-in. That was really helpful. She kept me calm, she kept an eye on me, she was always at the end of the phone. I could call her anytime and I updated her regularly with my blood pressure, difficulties breathing, sickness that I had, the fatigue, all of which are symptoms of being pregnant but also of the virus, so it was just magnified.
The main worry for me initially was Sally's health. And the thing about Sally was she was one of the first cases of COVID in pregnancy. Having an open communication line with Telehealth helped reassure Sally.
I also was in contact with an infectious disease specialist who reached out to me and he said that he'd been following our case from the beginning.
I've got a background in child health, infectious diseases, public health and epidemiology. And, you know, you're doing your research in the background, wondering how significant that is for the world and the community, and then a pandemic happens. So I gave Sally a call.
He was able to give me some continuity through all the tests, throughout everything. He was across all of it. A couple of weeks before his due date, Johnny came into the world and he was a very healthy, happy baby boy. I was very relieved by that. We continued to do tests on him when he was born. What we did discover was that Johnny actually never contracted the virus from me at all, but I managed to pass on the antibodies to Johnny.
Sally had the infection, she developed antibodies in her blood, and her body went into overdrive to send those antibodies to her unborn child. We don't know how long those antibodies are going to last. We'll be doing some of that work with Sally and with other mothers and babies into the future.
With what we know at the moment with Johnny's health, it's forever changing. We're still understanding coronavirus. And to have that accessibility, to have my health record myself, it's given me a lot of continuity. It's great for us to be able to access that information, as well as any doctor that we may see in the future. They have all the information in one place. That gives me great peace of mind as a mum, for not just myself, but for my children's health.